Dr. Gold, we talked about LASIK surgery, epi-LASIK surgery. I like to try to keep pointing that out, which is simply much less invasive, and most ophthalmologists don't do it. And yet it's so much less dangerous. So we talked about how it helps with nearsightedness. What about farsightedness?
Laser vision correction also works with farsightedness. In farsightedness, the light rays in the eye come to a focus much further back than they're supposed to, so that when they cross the retina, there's a significant, what we call a blur circle. And what that does to the patient, what symptom that is created by that, is that when they try to see something up close, they don't see it very well at all. And they can typically see better further away. And again, just like with nearsightedness, where that distinction happens is based on the prescription itself. If the farsightedness is very severe, the translation falls apart a little bit because they also can't see very well far away. So it's a little more complicated to explain.
Say that again. If the farsightedness is very severe, then what can they not see?
They can't see far away or up close.
Oh, I see. And so this can be fixed with LASIK surgery.
Correct.
And more or less the same procedure. You just, for the doctor, he has to be adjusting it one way or the other way. But for us patients going into it, it's the same thing.
Yeah, the patient's perceptions are the same. What they experience is the same. What's different are the laser settings. And like I said, with nearsightedness, the cornea is too sharply curved. We make it a little flatter. With farsightedness, the cornea is too flat, and we make it a little steeper. So it's just the reverse.
Got it. Now, again, let's touch on a little bit on, is it permanent? And you mentioned in another video that for some young people, it might sometimes be not completely permanent, but usually still adjustable down the road. Tell us about this situation.
Typically, people who require correction for farsightedness tend to be older than people who require correction for nearsightedness. And because of the cornea's wonderful ability to heal itself, sometimes that gets us in trouble, and the people who have been treated for farsightedness several years down the road may need additional treatment. Again, we're talking about very small numbers of patients. For example, in my practice, the overall rate of people needing additional correction or tweaking or fine-tuning is less than 2%. Those are pretty good odds.
Those are good odds in any, doesn't matter what you go in. Grant you, I once made a joke in I think it was in India, lots of people standing at the bus, and I said, hey, don't worry about it. Everybody except one will be able to get on. And so, if you're the one, you know how they say, if your neighbor is out of a job, it's a recession. If you're out of a job, it's a depression. You don't care about what the numbers are as long as you are out of a job, kind of. So and we're dealing with the eyes. But, so the few people who, however, need that little correction, it simply isn't the end of the world either. They just need a little correction then, right?
That's right, and it's a simpler procedure to have a touch-up later on than the original procedure itself was.
And I assume, well, I may be wrong, but I assume that touch-up, if needed, those 2%, is also cheaper than the original procedure.
Absolutely true.
Yeah, not that somebody should really pay too much attention to how much it costs to fix your eyesight. Nevertheless, we do all we live in an economic world with restraints. So,
we only get two eyes.
Yeah.
So I think that the people who do price shopping in order to determine who their LASIK surgeon will be are making a big mistake.
Yeah, I mean, absolutely. And those are probably the very same people who don't do price shopping on a TV. They just say, it's more expensive, it gotta be better. It has 3,000 more pixels.
Right.
Even though those 3,000 more pixels, they cannot possibly see a difference, especially not if they have an eye problem. Yeah, it is amazing. I know. I mean, in fact, the computer I'm shooting this video on with you, I remember when I bought it some a year and a half, and they said it's Blu-ray and it's this, and oh my God, what a difference. And I looked at it, and my wife was next to it, and I looked at her because she's more observant. She's an artist and stuff like that, and piano. And I go, do you see a difference? And she says, well, you see what I'm saying? It's, but yes. I do really myself sometimes not understand why people in big dentistry being going to a lab, it's always like they think they're they're buying a pencil where it doesn't matter, and yes, it matters if you buy 1,000 of them for your office for twice as much from some company, but not with eye surgery. It's just a different ballgame. Well, thank you very much for explaining farsightedness and nearsightedness and the application of LASIK surgery.